talking through all of this, what sticks out in my mind is the most horrible moments, obviously. And I have a few most horrible moments. And one of them was the first time that he overdosed, because he did it in my house. And I was actually already at the hospital with my younger son, who had hurt his ankle. But I remember the phone call coming in while I'm sitting in the ER already, that he was dead, that he had overdosed. And the paramedics were at my house, and they had to break into my bathroom to get him, because when he had fallen behind the door. So the most horrible moment for me in all of that was being at the hospital and seeing how the ER staff treated him. They treated him and me like we were the scum of the earth.
Yeah.
And they treated me like I was probably another junkie too. And I just happened to be there. But
by what? By what they were saying, or
just the way they looked at him and the way they looked at me, and how they were just throwing the utensils at him, and or not utensils, but the hospital stuff at him. And they threw the gown at him, and they're like, "You might want to help him." The way they treat you. And literally, while I'm standing there in the hospital room watching them give him the Narcan or whatever they're giving him, I'm on the phone with the airlines trying to get a airline ticket for him for 7:00 in the morning. So they let us go at 3 in the morning, and we literally did not sleep. We went home and packed, grabbed all the stuff that we possibly could. And we went to the airport before he could change his mind. I sat in the airport for hours with him to get him on that plane. And nobody had any type of emotion saying, "I'm sorry this happened to you." Everybody just treated him like a junkie. That was one of the most horrible moments for me.
Yeah, absolutely.
And nobody brings a casserole to a mom who just lost her kid to heroin or to drugs. Nobody says, "I'm sorry that happened to you." I've had people actually either not say anything to me at all, or say something like, "Well, at least you don't have to worry about him anymore." And it's that's horrible.
The prevalence of overdoses has strained medical staff to the point where they are behaving like veterans in the war don't want to meet the new guy or know the name of the new replacement, because they're not going to be around long. And what they're doing is they're seeing so many overdose deaths that they don't even engage with any kind of empathy because of how many people die. So part of that is stigma. Part of that is these ER staff. If they emotionally connect with every overdose person, they're going to be wrecked mentally because they lose so many of them. And it's gotten to a point where there's some of the conversation in the medical community is almost defeatist, where they're saying this opioid crisis, we're going to just have to let it burn itself out. And that's partially them being psychologically protected because they're losing so many people. So I hate that you felt that you didn't have empathy, but they're partially protecting themselves because people are dropping dead so much.
Well, that was the point that I was trying to bring up, is that's why I had even more stigma against it, because of the treatment that we received.
They reinforced everything you thought.
So it just reinforced my feelings of anger and not understanding and the stigma, and something needs to change out there, because somebody like me is looking to people like you, people at the hospital, professionals for that empathy, that help, that guidance, and we're not getting it.
No doubt.
It's in the rooms of Al-Anon. The empathy and the understanding is there. The families that are
What's
dealing
interesting
with
about that, though,
crisis.
Edwin, it's there, but parents struggle a lot with Al-Anon, because Al-Anon was designed for spouses.
Right.
And so it's real difficult as a mom to go and be told to kind of like detach from your son, because especially when he's 26, it might be different when he's 52.
Right.
Right.
So people saying tough love, and I never wanted to show him tough love.
Right.
Well, I did finally, and he ended up dead 4 days later.
Yeah. Right. And I'm telling you, part of it is we just have to, the rethink it. And I agree with Edwin. It's a war right now, but also some of them are just assholes.
Yeah.
And so like they're very judgmental. They have preconceived, stereotypical kind of like thinking. We've reinforced it unintentionally when we talk about ourselves and we throw these terms around, and you just have no one. Like that, it's heartbreaking that you're sitting in that situation, and there's no one coming back there to help you negotiate this conversation about the flight to Florida for rehab. There should have been a social worker in there, or you know what, pay us and we'll come in and do it. Like, you know what, like. But sit down and have the damn conversation about the reality of the situation. That's happening all day, every day.
That's interesting that you say that.
And they're saying, well, and every junkie that dies under the bridge, I mean, you know, that person could very easily have been driving a minivan and taking their kids to soccer before they got prescribed an opiate. But by the time
or in the military,
yeah, right. You know what I'm saying?
Yeah.
So people don't know the origins, but by the time they hit this crisis thing, you're just a junkie, right? And that's the part of this conversation that everybody needs to remember, is that people didn't start out under the bridge,
right?
And that's why, again, you got to get educated. We have to go back and read this book and understand that, and show this empathy and be willing to talk. But people are so, it's hard for people to reach out and be empathetic in these situations.
Oh, I was going to say, it was interesting that you bring up the fact that there's no social worker that comes in. That was one of my questions was, nobody was there to guide me. And the hospital staff, they didn't care. They had no caring at all about it and no information. They just told me he needed to get into rehab. Well, I already knew that. Thank you so much for giving me the obvious answer. But nobody came from the hospital and said, "Hey, I'm so and so. You know, do you have any questions? Do you how can I help?" Nothing.
Yeah, absolutely. And I feel like that's the part of the equation that's starting to change with some of these recovery movements and us becoming more open about it. Shows like this, I think that we have a world of, we have a ways to go, right? Like we're not even close to where we need to be, but we're trying and we're finally doing it. I have noticed in hospital systems, because of some of the programs that we run, where if you provide the physicians with the support from recovery coaches, in our case, they do respond positively. You might go back to your point, Edwin, that they don't know what to do. They're overwhelmed. And so, but the problem is that the funders, $69,000 for rehab, somebody's going to have to start changing the way that this is paid for and the way that this is dealt with, because, unless you put more social workers in there, nobody's going to be there for you. Unless you put more recovery coaches in there, nobody's going to be there for you. And you're going to be juggling your son's condition while you're on the phone with a rehab who's telling you, get him in now, get him in now.
And I'll also, especially with the heroin thing, when people graduate, and I think they should tell people that are dealing with these kinds of, especially opiates, when they relapse, there's this misinformation that, I'll do half of what I used to do, and that'll be okay. That's not okay. Half will kill you. And if you find yourself in a relapse situation and you're going to use again, an eighth or less. But because the half idea is what kills so many people, and that doesn't get talked about because we feel like we shouldn't say those things. But I think we should.
It all got to get talked about.
It's got to get talked about.
And you should have known, and the mom should be told, and everybody should be told. And again, we're not there yet, but we're working on it, and we're moving toward that. Lisa, is there anything else, if you just think back on the journey and just take a minute, is there anything else that stands out in terms of memories or experiences you had that you would want to share, be willing to share, that might be helpful to somebody else dealing with this?
Gosh, there's so much. I don't even know how to pin it down. I think it would have helped to understand why the doctors are prescribing that stuff at such a careless rate in the first place, and how come they don't have any type of warning or any type of support system for people knowing that they're going to get addicted. Right. I guess that was my biggest question, is how could the doctor do this?
Right.
I blame them for it,
Right.
Right. I was clueless. I really was.
Yeah.
All that information is in
Look,
that
man,
book.
it's all about information. There's no doubt. I'm sitting here thinking, like, the stuff I've been through with my kids. I want to know what's going down, and I want to know how to help them. You get that? And like in the addiction world, we don't do that. We throw you on Google and you go to rehab. Everything that you've talked about is you wanted to know, and no one would tell you.
No.
And I feel like that's where we can be. I mean, that's got to be our mission here at U-Turn, to get this information out to these families.
And one of the things that I want to say that was important was I had a full-time job, and I also had 2 other children.
Right.
I had 3 boys. And, I was a mom and I was an employee. I didn't have time to be researching on the internet
You need
and doing
information.
all this research and try and figure it out all by myself.
Right.
So it would have been important for somebody to say, hey, here's maybe the top 5 or the top places, or here's some counseling people that are willing to help. And I was a single mom. I also didn't have a lot of resources. I didn't have a big paycheck to pay for all the stuff that was required.
Or a therapist or whatever it would be.
If he had been diagnosed with cancer, they would have put together a team of doctors, a radiologist, an oncologist, and they would have come up with a comprehensive plan to treat his cancer.
Right.
And so I think we have to open up this conversation to someone that's been diagnosed with chronic substance use disorder needs to be treated by professionals that will come up with a comprehensive plan based on his or her situation.
Dude, it's phenomenal. Think about it for a minute. Like any other issue, you go on and you put it in Google, and you'll get to like WebMD, where it'll just there's problems with that too. Don't get me wrong, but it'll be like, here are the symptoms. This is what it could be. Think about this. It's not like call my rehab now.
Right.
It's unbelievable that there was nowhere that you could go to get that information, and he lands in a hospital, and you still don't get the information. Right. Again, I feel like that's the step that's like part of what we're trying to do today. But it's mind blowing when you're starting to think about it. Like your analogy with cancer, but take it even a step further. You have a cough that won't go away. Put in like persistent cough. Right. It's not going to be get in the car and come to the emergency room. It's going to be, this is what it could be. Right. Now that gets bad too, because you're like, holy crap, I got like all these different diseases. But do you get the point? Like it wasn't there.
Can I touch on that again? You're right, because I didn't have the information. I didn't have the time to do the research. But once he got to the hospital and overdosed, you would think that somebody would be like, hey, here's some information for you. Right. Here's what you could do. Here's where you can go. Right. But nobody offered that to me. So again, I'm on my own.
Yeah, literally on your own, on the phone. I mean, just picture that if you're out there. If you're watching this, think about that for a minute. Whatever you think about addiction or addicts or junkies or however you want to like call us, think about being a mom on the phone while your kid is dying and you're calling and trying to find out, like, how do I get him to rehab? And nobody comes in from the medical team to even talk to you.
So
and get in touch with the injustice of that process.
So I talk to medical students all the time. And they're starting to bring them to favor to see a meeting,
and we coach them and we teach them. Yeah,
right. and so they're starting to dip their toe in the water of what this really is. But still, when they're talking about substance use disorder or addiction during medical school, it's about 2 weeks of their entire curriculum.
If that,
and it's not, so what they know is kind of what we know. It's what we've learned from the television, what we've learned from watching shows like Intervention, which means not very much.
Not very much, and not very accurate.
And not very accurate. And so we hope to shed as much light as we can. Again, I talk about CDAP in Charleston and Dr. Anton. They're at the tip of the spear as far as the medical science. And the more we get into this, the better we're going to be able to treat it. But we're going to have to get the hospitals and the doctors to have this information on hand for people that are in crisis like you.
Yeah, it's like somebody should probably invent like a learning management system where people could go and learn about this stuff. Maybe somebody should think about that.
Right.
All right, well, we're going to let it go for today, guys. Again, Lisa, thank you for being here. This is incredible. Very, very important. That's all we have, guys.